Hey, Dr. Frank here for another clinically relevant. This is part two. In the first one, we were looking at a pretty cool article that came out comparing pistoning needling compared to sustained needling. So this is certainly one that I think is worth a read. In part one, we went through the methodology and just kind of what they were measuring. So I think that's a good one for you to watch as well. But just briefly, the researchers' conclusions of this stated that sustained insertion significantly outperformed rapid pistoning in the areas of managing the actual pain they were trying to do, which was neck pain, increased pressure pain thresholds. It reduced muscle guarding, i.e. tension and stiffness in the muscles. It improved tissue perfusion, which we know is huge when we're talking about needling. And then it had fewer adverse events, had a better safety profile, and it was tolerated better by the patient or the client itself. So next part of this is what I want to do is talk about how this influences and kind of goes along with what we talk about in IDN's training and how it specifically relates to neurologically driven care. So what we look at is we look at neurologically informed assessment, right? That's what guides treatment. You have to have an assessment to be able to guide your treatment. It's not a generic sort of myofascial point palpation, then following it up with pistoning, right? That sort of gives you the idea of it's a one-size-fits-all type of situation, and we know that's not true. In fact, in this particular study, they show that more needle insertions wasn't necessarily better than the sustained. Because a lot of times what happens is if you have excessive insertions, you do too much, right? You actually provoke the muscle guarding tension and stiffness, which is what we saw in this particular study. And those are all the reasons why you do dry needling is to reduce those. The next thing that we look at really is when we look at in sustaining the needle, one of the hypotheses of the researchers was they believed that sustained needling was better than pistoning because it allowed the nervous system to downregulate, right? Kind of promote a modulation, which I think is important. And, the reality is when you're needling, the longer you can keep the needle in, probably the better, right? We see some studies looking at the autonomic system and how it's improved by needle retention. But this is a clinically relevant segment, so we don't have 30 minutes to allow people to just lay on our tables. So I want to emphasize one piece, that needle retention in this study was only 1 minute, right? And you got all those benefits over pistoning. So it is clinically relevant and clinically doable to be able to needle in that way. Now, the other last part of this is, again, looking back to the needle retention, what that did was reduced inflammation, and that was by improving perfusion. And they looked at two different measures of measuring perfusion. So instead of amplifying like nociceptive input with excessive dosage, this was able to have a stronger vascular response, which will improve functional recovery and certainly aligns with our focus on neurogenic inflammation. Because we feel that if you can target areas of neurogenic inflammation, which will then affect downstream and upstream of whatever that nerve is talking about, you improve that peripheral nerve health. And that becomes a systemic model of neuromodulation, not just something where you're trying to, disrupt local trigger points. And then lastly, when we talk about just in general in this study, a couple other clinical relevance here is that it's not about chasing a twitch response. And there's other studies out there that show you don't need to get a twitch to have a physiological effect. And the other side of this that's, I think, super important as well is down-regulating protective responses. Just do enough that you need to be able to change the nervous system, right? Without excessively and putting yourself in a situation where you can over-treat somebody. And then lastly, you do that by being precise in your needling areas, right? So we're going to target areas of neurogenic inflammation, target then the corresponding pathways. And what we find is that yields a more robust and favorable neurophysiological response. So hope you like that. Thank you.